So this is going to be an initial program that I'm going to give to someone, actually one of my current patients, to work on trunk stability. And then most issues with back pain tend to come from this weakness that we have here. And then if we have restriction above and below, being at the shoulder or being at the hips, every time that I take up all the slack in that area, so as my arm goes overhead and my shoulder is tight or my mid back is tight, when I run out of room there, my lower back is going to then have tension on it to arch because my shoulder isn't flexible enough to keep lifting overhead. It's the same concept for my hip. If my hip is tight in the front, as my leg goes back and I start to take up all the tension in the front of my hip, I run out of room here, and then my lower back starts to move prematurely, and that once again loads tension back here. So a lot of the abdominal stuff that we're going to talk about, it protects the back from having excessive strain on it while we try and mobilize above and below to decrease some of these tighter areas. So first exercise is going to be this laying down position where you take your fingertips in the abdomen and thumb in the back, and you do some of your very light tensing the lower abdomen, pushing into fingertips, at the same time trying to keep your lower back into the floor and breathing 5 to 10 seconds, and then relax. And this is more of just a recruiting the right areas of the stomach to engage, and then we're going to apply this to some more higher level activities. So I'd recommend starting off with 5 to 10 of these, holding for 5 to 10 seconds, making sure that you continue to breathe comfortably and normally. Okay, so that's the first movement. Now, we're going to next work on keeping that as we work into some hip extension and some shoulder overhead movement. So the next thing I'm going to show you is working into hip extension. So I'm going to have a patient or myself start off with foot up on a chair or a step. And in the same position, I'll show you with my other leg on top here, I'm going to do the same engaging of my stomach. So very light tension in my abdomen, ensuring that my back is fairly flat and not arching in this direction. Keeping that tension, I'm just going to slowly let my front knee bend. And as I do that, and then I even start to squeeze my butt here a little bit, as I get in there, I feel this stretch or tension on the front of my hip. Okay? Now, if I don't keep my stomach and I let my back do this, as I come forward, I don't feel that tension now because I've worked around the tightness by compensating with my lower back. So that abdominal tension, as soon as I do that, that stretch comes back. And this is really the tight area that I want to pull on. So I have people just lower into it very slowly. That back heel can raise up off the ground. And as I get in there, my butt and stomach are where I'm kind of engaging. Pause, and then back out. I usually say somewhere in the 10 to 20 repetitions on each side. And I would do both legs. So that works on from the hip extending while keeping my stomach engaged. The next thing I want to do is I'm going to head over to the wall. And starting off at the wall, I'm going to do the same concept of engaging my stomach. Okay? Now, once I have that stomach tight, my back flat against the wall, I'm going to take my arms straight out in front. And a lot of people have a tendency to bend the elbows, so make sure the elbows stay very straight. And keeping that stomach tension, you're going to raise your arms up overhead as high as you can. And even as I get up here, right about there, I'm having a hard time taking my arms back to the wall. Now, if I want to make it really easy, I just let my lower back arch, and it goes back without any difficulty. So as I keep my stomach engaged, it really makes me force on working on stretching the tightness in my shoulders and mid-back that I would typically work around by just arching my lower back. So I would pause up here for 3 to 5 seconds and come down slowly to shoulder height. I can do this with free hand, or I'm going to grab this band, or you could do a broomstick or a golf club. But it's nice to have something that has a little tension to it. So this is just engaging another aspect of my shoulder, stomach tension, a little bit of outward pull as I go up overhead. As far back as I can towards the wall and back down slowly. 10 to 20 reps. So this gets shoulder flexion overhead, some thoracic mobility. We did the hip mobility on the chair. And then the last thing that I like to give people initially is getting this co-contraction of abdominal and glute with a little bit more of a pushing or functional plank-oriented motion. So as I come over here to the edge of this table, so I start off in this plank where my body is fairly straight, okay? And as I bring one knee up to my chest, what I do here is the same tension in my stomach and this leg that's on the ground. I push my heel into the floor and I squeeze my butt. And I do that as I push into that heel like I'm trying to push this stand forward. And I hold for 5 seconds, and then relax. And then same thing, up again, stomach engaged, push the heel into the floor and squeeze my butt like I'm trying to press off my heel and push this forward. Hold for 5 seconds, repeating 10 to 20 times with my left leg, and then switching and doing the same thing on the right. One common problem I see people do is as they start to push, they start doing something like this, which is a common pattern, right? Because as we tend to have stress to our body, that's what we do. We really arch or tense the muscles in our lower back, which feeds into a lot of the problems that we have. So that stomach tension, where I keep my back flat, is always the precursor for a lot of this stuff, because if you don't do that, you're going to work around that weakness and create pain. A lot of times people, when they try and engage their glutes and they kick their leg back, the first thing that happens is that back arches. So that glute activation starts to become associated with pain, because if it hurts my back to do this, and every time I kick my leg back I'm tensing, that becomes a problem, and it further inhibits the use of this very important muscle. So if we can get that stomach activation, which is what we do with that push, it keeps that lower back from compensating. And as I take my leg back, I get that pure glute firing without any irritation of the low back, which is why I like that counter push. So this is a good initial sequence for low back pain with no radiating symptoms, that's pure musculature and not necessarily a nerve-oriented problem.